Welcome to another short from the VetMed Digest. Feline hypertrophic cardiomyopathy is recognized as the most common heart disease affecting domestic cats, often impacting around 15% of the population, mostly in a subclinical phase. Defined by the thickening of the muscular walls of the left ventricle without another underlying cause, this heterogeneous disease can progress tragically, leading to outcomes like congestive heart failure, arterial thromboembolism, or sudden death. Given that detailed tools to predict which asymptomatic cats will progress to severe stages are currently lacking, developing effective treatments remains a primary challenge. Feline hypertrophic cardiomyopathy serves as a critical, naturally occurring translational model for the human condition, sharing key molecular and clinical features, notably ventricular wall thickening, myocyte disarray, and the spontaneous presence of left ventricular outflow tract obstruction. In specific breeds like the Maine Coon and Ragdoll, the disease is associated with variants in the myosin-binding protein C gene. Diagnosis relies on echocardiography, the gold standard, identifying left ventricular wall thickness greater than 6 mm as indicative of hypertrophy. Crucially, the functional abnormality that drives clinical disease is diastolic dysfunction. While biomarkers such as N-terminal pro-B-type natriuretic peptide aid in evaluating severe cases, they should not be used as the sole diagnostic measure. Holter monitoring confirms that arrhythmias, including ventricular and supraventricular types, are frequent in affected cats. Traditional therapies, including calcium channel blockers and beta blockers, target nonspecific symptoms rather than the underlying pathological mechanism of hypercontractility and hypertrophy. And studies have shown drugs like atenolol do not prolong 5-year survival in subclinical patients. This limitation has spurred excitement around targeted therapeutics. Novel cardiac myosin inhibitors, such as mavacamten, demonstrated success in acutely relieving left ventricular outflow tract obstruction in cats. A subsequent inhibitor, aficamten, similarly showed beneficial dose-dependent reductions in systolic function and pressure gradients in Maine Coon cats with a relevant genetic mutation, indicating an optimal therapeutic range lower than 2 mg per kilogram. Another innovative approach involves delayed-release rapamycin, which inhibits the mechanistic target of rapamycin pathway. A clinical trial demonstrated that a low dose of this formulation significantly reduced the maximum left ventricular wall thickness compared to placebo over a 6-month period, suggesting potential for preventing or delaying hypertrophy progression in subclinical cats. These discoveries offer significant hope for effective management beyond just symptomatic care. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.